There was a big story in New York Times today about just how successful the Affordable Care Act, and particularly the aspect of expanding Medicaid in Kentucky, has been. They have already signed up and enrolled, signed up and enrolled 56,000 new people to health insurance plans. They have about 10, 11 times that in uninsured people. So they have already basically signed up about 10% who had no health insurance. That's pretty stunning. And even more stunning than those numbers is to just sort of read the stories of people. I mean, when you compare the complaints from, Dylan Radigan is now paying more, $500 a month more for health insurance versus people who are like, I haven't been to a doctor in 13 years. I've got this ailment, that ailment, this ailment. I was just going to deal with it more and wait to die. The per capita income in Breathitt County, I guess, is $15,000 a year. The rates of diabetes, hypertension, and other health problems earn this part of Kentucky the nickname Coronary Valley. Now, you recall, this is a state that is one of the few who we perceive as red states. They have a Democratic governor, Steve Beshear. He went ahead to expand Medicaid. He also set up one of, 16 state-based exchanges rather than saying to the feds, you deal with it. And it's paying off dividends. There's a lot of people, I imagine, walking around Kentucky, particularly Appalachians, who are saying, holy crap, maybe we should all move to Kenya and get under this socialism thing because this seems pretty good.
So if you actually implement healthcare reform and try to deliver for your people, it might actually work.
It might actually work.
That's
or
pretty stunning.
The danger is we're going to have a lot of people applying for Kenyan citizenship.
Right.
Going around reading Marx.
Dude, that's, Lord knows, I hope I get my Kenyan citizenship.
And I want to remind you, people, that, of that 57,000 that have signed up for new health care coverage, almost 46,000 of them are on Medicaid. That is full-on socialized insurance. It's not socialized medical care, but it is socialized insurance, full-on.
I was just thinking, going back to McConnell, though, I mean, this is, in some ways, it seems like an obvious point, but I think, the implications of running on this abstract thing called Obamacare and Kenya and all that nonsense versus I am the guy who, in my re-election campaign, my number one commitment is to take away your health insurance.
Right.
That is quite a proposition to have to run on.
Yeah, that's going to be much harder. Much harder, I think, to, it's one thing to campaign against something that is just behind a black curtain, as it were. But as soon as that curtain gets opened up, there's a problem. Now,
the curtain gets opened up to you and your family have a health care plan. Right?
What's that? Yes.
Like that curtain gets opened up to something good.
Yes. Then you've got a problem running against that.